Well, hey guys, we have another TikTok virality to challenge in today's video. Have you guys seen this trend going around on TikTok where people have claimed that Accutane gave them basically a free nose job? It's even a hashtag, I think. I am on TikTok, by the way, shameless plug. So if you are into TikTok, make sure you follow me over there if you would like to, I don't know. I post a lot of skincare and also hair care type content. A lot of videos on TikTok of people claiming that because they went on Accutane, it gave them basically a free nose job and it shrunk their nose. And I've been getting tagged in these posts asking to debunk it. And it's kind of funny that people are making this claim because typically on the internet, people love to demonize Accutane. So if they're gonna be making a shady claim, at least, it's something potentially positive about Accutane. I feel as though the internet is ripe with fear mongering against any type of prescription drug. Like there's just the statements over and over again that, pharmaceuticals must be the devil. Accutane, as a side note, is a wonderful drug. It's very effective. Yeah, Accutane cures acne for many people, but can it give you a free nose job or a rhinoplasty? Short answer is no, but it can kind of change the appearance of your nose potentially. You know me, there's never a yes or no answer. We don't work like that. There's always a catch. All right, how does Accutane work? It works in acne because it causes death of the oil gland cells and in effect shrinks your oil gland, reducing oil production. That's part of acne. People who have acne, they have a higher amount of oil that goes into the pore, fills up the pore, and then they also have a problem with skin cell turnover within the pore. That leads to plugging up of the pore, and then the bacteria that live in our pore break down your oils that are in there, and that generates an inflammatory response, and that's how you get acne lesions. So Accutane treats both the oily component of acne as well as that proliferative issue that goes on in the pore. So it basically shrinks your oil gland. Now, because it does that, if you have skin that kind of has hyperplastic sebaceous glands, skin thickening as a result of that, you may appreciate this kind of a reduction in the size of the skin, but it's not a nose job. When you get a nose job or a rhinoplasty, they are altering the cartilage and the bone, and Accutane does not modify those structures whatsoever. So if you hate the way that your nose looks, like the shape of it or whatever, don't believe that Accutane is going to correct that. But Accutane can, like I said, help with conditions where you have sebaceous hyperplasia. Sebaceous hyperplasia, typically you think of it as that skin condition where you have those little bumps. People call them enlarged oil glands. And in fact, low-dose Accutane can actually improve the appearance of those and make them, kind of resolve and go away and reduce the chances that you make more of them. Now, there's another type of sebaceous hyperplasia-related condition that can happen in some people with rosacea called phymatous rosacea, where you get kind of an overgrowth of the oil glands as a result of all of the inflammation and inflammatory responses that are occurring in rosacea. And that can really be disfiguring. For whatever reason, it seems to happen in men more so than women, and it most often affects the nose. But it can also occur less commonly on the forehead or the chin, just as a result of overgrowth of those oil glands. And low-dose Accutane actually can improve that quite a bit. So if you had that condition and you went on Accutane, yeah, you might see an improvement. It's not like a miracle cure for it though. Typically that condition requires a surgical intervention to resurface the skin to improve the appearance of the phymatous rosacea. But yeah, that definitely would lead to shrinking of the oil glands and improvement in overall size and shape of the nose if you had that. But these people on TikTok, I don't think they ever had phymatous rosacea. I do have a video on low-dose Accutane for like an anti-aging benefit. I get a lot of questions about that. And so check that video out. Some people even, I even have colleagues who take low-dose Accutane just for the cosmetic benefit of it. And actually in Hollywood, this is kind of sad. In Hollywood, young actors would often be put on, and they probably still are, truthfully, low-dose Accutane, young actors, to reduce the oiliness and just keep their skin looking more even and glowy. Because as you go throughout the day and the oiliness that your pore puts out kind of builds up on the surface of the skin, it can make you look shiny. And if you're wearing makeup, then that can impact the longevity of the makeup. So for convenience sake, people just go on low-dose Accutane, which is kind of, I mean, if it's your choice, fine, but I always worry about young actors in Hollywood. Especially child actors, I don't know. I would be interested to know, actually. I mean, I'm not obviously a Hollywood dermatologist, but I would be interested to know what kind of protective, it just seems like a conflict of interest. Like, let's go on this medication, which, as I said, is more than safe, but it does have side effects and it does have risks. But let's put, a young person, a child, on this medication simply to make them look better. That seems very suspicious, but it does in fact happen, and it can make your skin look, more even and whatnot. Of course, it can be very drying. That's why a low dose is used, but part of me was kind of glad to see that at least they were, making bold claims in a positive direction about Accutane, because like I said at the beginning, there's so much fear-mongering around Accutane, and it is very difficult to dismantle those hard-fixed, hardwired beliefs, false beliefs about Accutane. Yeah, people get really afraid of Accutane because, of course, it is a teratogen. You can't take it and get pregnant. It will cause birth defects, and that really scares people. But people fail to realize that many medications that they take also can cause birth defects and are not recommended in pregnancy. There are so many medications that we use in dermatology that are also teratogens, and you would never, ever, ever prescribe to a woman who was, not on birth control, or, without the discussion that, like, you absolutely cannot get pregnant on this. I mean, there are a ton of medications that we use a lot in dermatology. See, people just think that all we do is Botox and filler, and like Accutane is the only medication that we really utilize. But actually in medical dermatology, we use a lot of medications that impact the immune system, and are basically, we use a lot of chemotherapeutics, actually. Same medications that you might take if you have a cancer, same chemotherapies can be used to treat a variety of inflammatory skin conditions and are necessary. They have pretty serious side effects. And you may, for example, you may have heard of the drug thalidomide, and you probably are terrified of that, right? Because it got a lot of bad press. It's actually a great medication for chronic itch and a variety of chronic inflammatory skin conditions. However, you would not want to give it to a woman, during pregnancy, because it will cause horrible birth defects. That is why there's so much fear-mongering around thalidomide, because initially it was prescribed for women. It was given to women for morning sickness without knowing that it caused these birth defects. And because that happened, which is horrible, it changed the landscape of how people view this drug. But there are so many drugs that we prescribe in medicine that will cause birth defects. But it's simply the fact that it got so much media hype at that time. I'm really going off on a tangent here, so you probably have clicked out of the video already at this point. You're probably like, okay, we get it. Accutane does not give us a nose job. Bye. But if you made it this far, yeah, I mean, there's so many medications that are prescribed, not only in dermatology, but, across the medical field in general, that will cause very severe birth defects. So yeah, as I was saying, thalidomide is an example. Like, obviously we would never give it to a woman who, might become pregnant, would counsel women on that. But because we didn't know in the beginning that it caused birth defects, and it was given to women for morning sickness and then caused horrible birth defects. So you guys have to remember that just because people are repeating something over and over again, or repeating a statement over and over again, doesn't mean it's necessarily the hard and fast truth, or that there isn't some nuance to it that that could challenge what is being said. And in the case of Accutane, yeah, it's not safe to take and then become pregnant. That will cause birth defects, but that doesn't mean the drug is harmful. It actually can cure acne. Same thing with thalidomide. You would never give it to a woman who might become pregnant, but it's a great drug for a variety of chronic inflammatory conditions. It's really just how things are conveyed to you. How the information is conveyed to you really skews your view. Do you see how media really can feed into different cognitive biases to really change your opinion on a drug? It makes it a big stumbling block then in medicine. We have to spend a lot of time dismantling these false fixed beliefs about certain drugs and communicating to the patient that it might actually be their best option. Like if you tell somebody, hey, I think thalidomide is a good drug for you, you almost always get a response. But in reality, it is actually, when prescribed to the appropriate person and monitored and supervised, it's a very effective medication for a variety of inflammatory skin conditions. Yeah, you have to be careful. Just because people repeat things over and over again, and just because many people are saying the same thing, it doesn't make it factual. Repetition does not equal reality. And that is a problem that has always been in existence with media, especially headlines, promoting certain things. But now that we have social media and things like TikTok, where people just get on there and, say whatever is trending and repeat it because it's a trend, it's a hashtag. It doesn't mean that it's true. People are engaging with it, so it gets amplified and it, goes viral. And this is how misinformation spreads, and it can be very dangerous. So yeah, at least in this case, nobody is likely to be harmed from, believing that Accutane is going to change their nose shape and give them a free nose job. Unless you got a hold of some Accutane and just took it, you should never do that. I worry about things like this though, with the age demographic on TikTok is much younger. And so I would worry that somebody, some young teen would be unhappy with the way that they look. Maybe they don't have acne or anything, and then maybe their older brother or sister is on Accutane and they get a hold of their Accutane medications and just take them willy-nilly. That can be that could be dangerous for sure. So, hopefully they see this video and understand that no, it's not actually going to give you a free nose job, but yeah. Yeah, TikTok, it is not where you go to do your research, as I say. If you are doing your research about anything using social media, I'm telling you, you're doing it wrong, because it's just gonna show you the same lie over and over again. Be very mindful of the limitations of the information that you can get on social media. Check the person's qualifications, make sure they know what they're talking about. And that's even troublesome too, because there are a lot of very qualified people on all of these platforms who have great qualifications, but they're talking about something that they're not qualified to talk about and spreading misinformation because of, monetary incentives or whatever. So you also need to understand, yeah, a person may have doctor in their title, but what kind of doctor are they? For example, I am a dermatologist and I went to medical school. I went through all of the specialties as far as training, and then I did, after medical school in dermatology, we do an intern year in a hospital. So I took care of patients in the ICU in that year. I took care of patients in the emergency room. And so, but that was like the last time I really took care of patients in that way. Beyond dermatology. And so if I got on here and was telling you guys how to control your diabetes, you really should not listen to me, because I couldn't tell you how, I can tell you the basics about it. And I understand enough about diabetes, and I actually have managed somebody's blood glucose numerous times, but it's been a long time. It's not something that I daily practice, and it's not what I have the qualifications for. And I think that's really where people can easily be misled on the internet, because a lot of people don't understand what physicians and what type of doctors and education and titles or whatever bring to the knowledge base of something. And so you have to do a little bit of digging. Is this person actually qualified to talk about this? It doesn't mean that they don't know what they're talking about, but you should fact check in that sense. I don't think any of the people who are talking about the Accutane being a dupe for a rhinoplasty have any medical background whatsoever. I think they are just hopping on a hashtag trend. The other thing is that a lot of the people on the TikTok platform who are sharing these images, they're young, really young, and then the pictures that they're showing as like before, they're very young. And with puberty and with, you know, growth spurts, your face and bone structure does naturally change. It's not that the Accutane gave you a nose job. Obviously you retain your, you know, the way that your face looks for the most part, but there are subtle changes to the face. Anyways, guys, I know this video was a little bit circuitous, but I want to drive home the point that just because things are repeated over and over again and a lot of people are saying the same thing, it doesn't mean it's right. That is how cults get, you know, started. And not to say that this is a cult, but just be very mindful of the fact that just because people are saying something doesn't necessarily mean that it's true. Anyways, I hope you all are having a good day. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.